My name is Mark HALLET. I'm the Chief of the Human Motor Control Section of the National Institute of Neurological Disorders and Stroke, and currently I'm the President of the International Federation of Clinical Neurophysiology. Today I'm going to be talking about functional movement disorders, which is a type of functional neurological disorder. These are disorders that are actually very common. All neurologists see these patients. Approximately 10% of new patients that come into neurologists' offices have a functional problem. These are very difficult problems to both diagnose and manage, and many neurologists do have trouble with this, but education is increasing. These disorders are neurological problems, or in the case that we're talking about today, movement disorder problems that presumably have a psychological as opposed to an organic cause. Now, what I'm going to be talking about in the lecture today is how this can possibly come about. How is it that it is possible for a disorder like this that can be an involuntary disorder for the patient present in this particular fashion. Now, one of the things that I've been doing is to try to understand physiologically what's going on with these patients. One of the first observations is that many of the different aspects of the way that they have their movements are very similar to voluntary movements. Now, they're not exactly the same because the patients don't have the sense of voluntariness, but they obey certain rules similar to voluntary movements. So the mechanisms in the brain seem then to be controlled by other systems other than what gives the sense of voluntariness. Now, we have been trying to understand where the sense of voluntariness comes from, and it looks like this comes from a place in the brain relating to where feed-forward and feedback signals for movement get together. And one of the important regions for that is the right temporoparietal junction region. And in these patients, there is a dysfunction of that particular region. But then there's the other question of where the movements come from in the first place. And the evidence that is accumulating recently suggests that it comes from an abnormal function of the limbic system. So in a sense, this gives us a link to the psychiatric or the psychological side of this particular problem, in that an overactive or dysfunctional limbic system produces the movements, and then the movements are not appreciated as voluntary because of a problem with the feed-forward feedback connection. So these are the things that I'll be talking about in the lecture today, and I hope to give some understanding about where these problems come from.